Assalamu alaikum dear students, it's Dr. Masma Mehtab. Welcome to my YouTube channel Medical School. So today we will be discussing about viral hepatitis. So let's go. Now hepatitis is a term that is used for the inflammation of liver parenchyma. Now this condition mostly occurred due to the viral infection. So let's classify the viruses that can cause hepatitis. So we have hepatitis A virus, B virus, C virus, D virus, and E virus. Now remember, all of these viruses belongs to the single-stranded RNA virus, except HBV virus, which rather belongs to a double-stranded DNA. So this is the exception that hepatitis B virus is double-stranded. However, all of these remaining viruses are single-stranded RNA viruses. Now comparing the hepatitis A with hepatitis E virus, because they show some of the similarities, that's why I have comparing both of these for your ease. Okay, so both are transmitted by fecal-oral route. Both causes acute hepatitis, so there's no any chronic form. Now, in both cases, there's IgM that marks active infection. However, IgG marks a protection against virus. That means whenever there's IgM elevated, that means the person or the patient is going through the active infection. But when there's IgG, which is elevated, that means the patient is actually recovering. Okay. So, what is the difference between them? Now, immunization is only available against hepatitis A virus but not for the E virus. And then hepatitis E virus causes infection in pregnant women mostly. So, in pregnant women, there can be fulminant hepatitis. In this case, there is massive necrosis of liver parenchyma and decrease in liver size. So, the liver will be in acute yellow atrophy. So, here you can see this is the liver going through the fulminant hepatitis. Now, this liver shows a shrunken and hemorrhagic liver as indicative of parenchymal loss. Okay, then comparing hepatitis B with the C virus because again they also show some similarities. So both are transmitted by parenteral route and unprotected sex. Now both can cause chronic hepatitis, but chances vary. That is to say, only 10% of the cases, in only 10% of the cases, hepatitis B virus can cause chronic hepatitis. However, in 50% of case, hepatitis C virus can cause infection like chronic hepatitis. Now, in both cases, there is risk for hepatocellular carcinoma. And the incubation period of both viruses is 1 to 26 weeks, which around. Now, come to the serological marker for HBV. So, there's hepatitis B serum antigen, which is the first marker. Then we have hepatitis C, that is the core antigen. This antigen comes from the core of the virus. So this represents window phase. And then we have hepatitis EAG that shows us the active infection because what happens, hepatitis EAG is secreted or released when there is destroyed hepatocyte by means of the viral infection. So it actually is a marker for the active infection. And then we have anti-HBV, that is the protective antibody that shows that mark that the patient is being recovered. Now, prevention is by means of vaccine. So, come to the serological marker for HCV. Now, in this case, there will be episodic elevation of ALT as and AST, but ALT will be elevated more than AST. Then come to the HCV, that is hepatitis C virus RNA that can be seen within 1 to 3 weeks. Now this indicates us, this is a test basically through which you can suggest the patient or you can guess or diagnose the patient with hepatitis C virus. And along with the PCR, so PCR is also necessary along with that. These are the confirmatory tests. Okay, the remaining virus we have hepatitis D virus. Now, it is transmitted by parenteral route. It usually occurs as co-infection with HBV, hepatitis B virus, and superinfection with HBV. But superinfection is actually more disastrous as compared to the co-infection. So the superinfection with HBV can result in acute severe hepatitis, fulminant hepatitis, or chronic hepatitis. Now let's talk about the stages of hepatitis. Now remember that the patient will be presented to you according to the stages. That is to say, at what stage the patient is going through. So, in early stage, there's asymptomatic stage. There can be minimum elevation of serum transaminase and presence of viral antibodies. The patient becomes symptomatic when there's prodromal stage, and third stage is icterus stage. So in the prodromal stage there will be fever, malaise, painful hepatosplenomegaly, and elevated alanine transaminase and aspartate transaminase. Remember again, ALT will be elevated as compared to the AST. Now the third stage is icterus stage. Icterus, we have talked that icterus means yellowness. So it in this stage there will be jaundice and there will be hyperbilirubinemia in conjugated form. So if there is conjugated bilirubinemia, there will be dark urine because the conjugated bilirubin is excreted via the urine because it's water soluble. And then there will be light stool and pruritus is again because of hyperbilirubinemia. Okay. I hope I'm clear up to this. So that was all about viral hepatitis. Thank you. Allah.